So I'm going to explain to you why you should not sleep in your contact lenses. So you know that clear part in front part of your eye called the cornea? Well, that piece of tissue, that piece of anatomy is actually perfectly clear. Now, how can a part of your body be clear but still get oxygen? Well, it's actually from the air. The rest of our body gets oxygen via the bloodstream. So you have blood vessels running right throughout the body. So what happens when you actually wear a contact? When you put that on, right, it cuts down on the oxygen your cornea gets already. Now, when you sleep in it, you pretty much starve your cornea. So what happens is you get these little tiny blood vessels that start growing in from the outside and kind of grow in. And I've seen patients actually permanently damage their eyes, unable to wear contacts again, unable to get LASIK, because no LASIK surgeon wants to go in and try to do a surgery and then cut blood vessels, and then they got a bunch of bleeding they have to deal with during the surgery. The other issue is actually it will cause your vision to blur. So what happens when you sleep in it, your cornea cells start changing shape. So how can your cornea be clear, right? It's made of cells. How does it do it? Well, kind of cool. These little hexagon-shaped cells that make up our cornea. If you guys ever picked up like a honeycomb, like off the ground as a kid, and you pick it up and you turn it and you're like, I can't see through that. But then you turn it just right and you're like, you can perfectly see through that. That's what the cornea cells are shaped like. Now, when you sleep in it, it's actually going to change the size of these cells. So they're actually going to change in size and get larger or smaller. And what that produces is corneal haze. So maybe you have issues like driving at night, you know, halos and things around lights. So you definitely, and of course, dryness is there too as well when you sleep in them. So hopefully that kind of gives you some information why you shouldn't sleep in them. I know there's infection risk and those things, but you know, and that surely can happen. You know, I've definitely seen patients, but overall I see way more damage, long-term damage with overnight wear, kind of with those low oxygen levels that are in the cornea, and that can cause way more damage than sometimes some of these infections. So please, if you do sleep in your contacts, stop and make sure you're getting your eyes examined yearly.